We will be introducing you today to the techniques used to perform vital signs quickly and accurately. Enter the room and perform hand hygiene. If in a hospital setting, provide privacy for the patient. Introduce yourself to the patient and verify ID with date of birth and full name. If in the hospital, you may use the armband to do this as well. Explain that you will be taking some vital signs. Obtain the pulse oximeter and apply it to the patient's index finger. Move on to taking the temperature. Remove the blue probe from the storage for oral and auxiliary temperatures. Insert the probe snugly into a probe cover and request the patient to open her mouth and insert the probe under the tongue and to the side. Regular temperature is 98.6 degrees Fahrenheit or 37 degrees Celsius, taken orally. Move to taking the radial pulse. This is done on the radial side of the forearm or the side of the thumb by placing the tips of 3 fingers in grooves formed along the radial side of the arm. Note, the pulse is superficial and does not require deep palpitation. It can be absent, thready, weak, normal, or bounding. Count for 30 seconds and times it by 2. While still holding on to the wrist, count the respirations by watching the cycle of the patient's chest rise and fall for 30 seconds and times it by 2. At this time, the temperature will be done and you can remove the probe and discard the cover into the trash. Remove the pulse oximeter and record both measurements along with the respirations and pulse. Next, listen with the stethoscope to the apical pulse. Find the suprasternal notch. Follow over to the second intercostal space. Proceed to the 5th intercostal and follow to the left to the mid-clavicular line. Place the bell of the stethoscope over the apical area and listen for an entire minute. 60 to 100 beats per minute is within normal limits. You may now apply the blood pressure cuff. Apply it to a bare arm with the palm facing up. Do not hyperextend the arm and place the cuff 1 to 2 inches above the antecubital space. Hold the upper arm at the level of the heart and the lower arm can rest on a firm surface. Palpate the brachial artery. This may be found at the groove between the bicep and tricep at the elbow. Place the tip of 3 fingers in the muscle groove on the medial side of the extended arm. Inflate the cuff and note manometer gauge when the brachial pulse is obliterated. Deflate the cuff and rest the arm for 1 minute. Palpate the brachial artery again and place the diaphragm of the stethoscope over it. Reinflate the cuff to 30 millimeters of mercury above the point at which the brachial artery was obliterated. Slowly deflate the cuff. Note the point at which the pulse is heard and then disappears, and continue listening for another 10 to 20 millimeters of mercury. Completely deflate and remove the cuff. Record the reading and assist the patient to dress. Sometimes you're unable to obtain a blood pressure in the upper arm or forearm due to cast, dressings, IVs, and or other devices on the upper extremities. In these instances, you may obtain a lower extremity blood pressure reading, but we will not be demonstrating this. As pain is the 5th vital sign, you always want to include it in your assessment. You may ask the patient if they are experiencing pain and what level it is at on a verbal scale of 0 to 10. 0 being no pain at all and 10 being the worst pain they've ever felt. Continue by inquiring about onset, where the pain is located, and ask them to describe the pain to you. Is it achy, throbby, sharp? Have the patient tell you how long it lasts and what seems to spark it and what helps alleviate it. Be sure to document your findings and any treatment given. It is vital that you reassess the patient's pain within 30 to 60 minutes and document your findings as well. This ends our vital sign assessment video.